Wow. And we are live. So, good morning, good afternoon, good evening, everyone, and welcome to our fifth session where we're going to talk about NCDs. We started this conversation the other time with my amazing colleague and nutritionist Grace Njuguna, where we talked about why the cases are rising. And if you have not yet had a chance to have a look at that discussion, you might pause this and go back, or you watch it and then go back so that you can understand where we are coming from. So, in today's discussion, we're going to now start on strategies that can actually help in combating and reducing the incidences and the prevalences of NCDs in Kenya globally, and definitely because it's already a global public health problem. So, I am joined again with Grace Njuguna, who's a registered dietitian, and she is a nephrologist, nutritionist. Allow me to invite Grace to introduce herself, and then she tells us why she's here again and why this conversation is important. Grace, karibu sana.
Asante sana Lilian. My name is Grace Njuguna. I'm a renal nutritionist. I delve a lot with chronic kidney diseases, and primarily before that, trying to tackle, the non-communicable diseases that are there, causing the chronic kidney diseases. So we're talking about type 2 diabetes, we're talking about hypertension, of if you like, persistent high blood pressure, cardiovascular diseases, or everything heart health as well. So the conversation today is very, very important because now we get to delve into the solutions we are needing so much to reduce the burden of people having to be diagnosed with non-communicable diseases every other time. And sadly, the reality is that there's a huge increase. Gradual, yes, but it is there, and we can arrest it as early as now. Lilian.
Great, great, great. And the fact that gut health is currently trending, someone might just think that this is a trend. This is something that is being used again by these wellness coaches or functional doctors or medicine to actually now try and attract the masses. So maybe we can
Yeah.
just have a small recap of why gut health matters. And yeah, we can just talk about why it matters, what it is, and why it's currently rising, and why the need of gut health is currently like being seen or being felt. Because I have seen on TikTok, like when I upload anything to do with either preventive health or curative or even management of either diabetes, hypertension, or even cancers, and I check on the analytics and some of the search words that are highly looked into or that are actually having a lot of traffic is gut health. So why is it? Why is the link? Why is it in the rise? Why is it being popular currently, especially when you think towards NCDs?
Well, I would believe because one, we're Kenyan, so majority of what we figure out is, so what is the in thing. But right now, I want us not to look at gut health from the trending thing, the in thing, rather than what is supposed to be running your system. Now, we have a tendency of saying that your gut is your second brain. As soon as you are unwell, your gut system, well, your gut, the abstract noun, but also your gut, the digestive system, will speak out loud and tell you something is not okay, something is wrong. So why the one untapped role of the gut health is because for someone who's getting diagnosed with non-communicable disease, it means that their gut health has been poor for a while. All right. So, what do we mean by gut health? Gut health is simply denoted as having a healthy and functional gut bacteria and all these other things that are very necessary for running our immune system, fighting disease, fighting what we call inflammation. So, way before the disease starts showing up, your body is already fighting. It becomes your defense system. right? So that is your defense system entirely. So by the time we are saying one is getting diagnosed with an example of diabetes, it means that their gut health has been doing a lot of fights for a very long time, and it has not been replenished as well for a very long time. So what does that mean in the long run? That if we can talk about maintaining that gut health right now, we can prevent the approach of the near approach of non-communicable diseases as early as now. That is what we are looking at, Lilia.
For sure, Grace. I agree with that. I agree with that. And because you see, as you have said, it being our second or our brain that actually now helps with the reduction or the fighting of immune system, then we need to totally understand it. And maybe before we get into the nitty gritties of the link between the gut or what is the gut or why is what exactly is the gut, maybe we can try and dissociate or debunk some of the myths that we have seen about gut health. I have seen a lot where the only solution that anyone gives for gut health or anyone struggling with NCDs or gut dysbiosis is fasting. And we do understand the benefits of fasting when it comes to maybe repair, autophagy and all that. But is it the only thing that people can, or someone who's struggling with gut issues or even gut problems or even NCDs can actually do to reset the gut? Maybe we can just try and demystify that myth and then continue to the understanding of what gut health is.
Well, fasting is just but one of the ways, all right? So it is one. Excuse me. So it means then, practical example, you get to do an 18-hour fast for you to start getting an increase in growth hormone. Okay. So that alone is one thing. But then how do you break your fast? So you've healed your gut. There's already microbiome, the bacteria we're looking for, the healthy bacteria we're looking for. It's already in your system. How do you feed it? How do you maintain when you get to break your fast? So what are you breaking your fast with? How much of we talk about fiber in two forms, soluble and insoluble, but in total you require 25 to 35 grams of fiber in a day. Are we achieving that, or do we do fasting, break with what is available and move on swiftly? We will not achieve proper gut health with fasting alone. That is just but one of those things that we get to do. There's so many other things that you get to do. What is on your plate? What are you drinking? Are you going taking coffee on an empty stomach? There are all these things that are there. I'm just naming but a few. Fasting alone, let me say that again. Fasting alone is not enough to do good to your gut health. You have to feed, you have to replenish the gut microbiome, or what you're saying, the the bacteria, the healthy bacteria, and all these other amazing bugs that stay in our system for good health. So fasting alone is not enough. There are so many of the things that we can do to replenish that. So we're talking about probiotics. Probiotics are now the bacteria themselves. You can either get them as cultures. We're talking about such as kombucha, kefir grains, kefir milk. You're looking for something that will give you more than 10 billion microorganisms, more than 10 billion microorganisms with every 5 ml. And kefir grains, kefir yogurt, you're talking about kombucha, sauerkraut. So your fermented cabbage is actually an amazing source. We're talking about kimchi. If you can, make kimchi at home, that is also amazing. I've seen amazing of colleagues of ours who are doing an incredible job with these things, and you can always look out for them. If you're not able to make them at home because of time constraints, etc., you can always purchase from our colleagues who are doing an amazing job with gut health products. So again, let me say it: fasting alone is not enough. Fasting alone is just but one of those methods. You add, for example, you take your meal, and you're achieving 25 to 35 grams of fiber in a day, and you take kombucha 100 ml to 150 after your meal, you've done an amazing job, because one, not only have you allowed your system to redo itself, but you've also ensured that your gut is being fed and you're replenishing. So there's the feeding of the bacteria, so which we are doing by using fiber already, 25 to 35 grams in a day. You'll be doing an amazing job with yourself. So those ones we call them prebiotics. And then we have probiotics. And the probiotics here are for someone who's deficient already. You're giving an If I'm giving an example, it would be someone who is obese and came to me, and we're starting the weight loss journey. One of the things that I have to do is ensure that we are replenishing the system anew with probiotics, and kombucha is an amazing sauce. You take it chilled, it's really soothing, so it becomes something that you enjoy while you get through your weight loss journey. And now it becomes part of your lifestyle, because again, what is the purpose of doing all this if you're not talking about lifestyle? You get to lose weight, you get to your target, and think you can go back to that. It is not really a good thing. We have to talk about sustenance of your lifestyle for you to have good behavioral change. So we've talked about probiotics, we've talked about prebiotics as well, and then now we have postbiotics, or symbiotics, which now you get to combine both prebiotics and postbiotics. I mean probiotics for someone who gets to do good gut health. And again, remember, the most important thing we have to keep emphasizing is that it requires maintenance, consistency. Discipline is not perfection, it is consistency. So you have to be consistent with the same. Lilian.
Kabisa, Kabisa, I totally agree with you. And maybe for that person who's watching who does not understand what the gut health means, or they've just seen a lot of trends and they're wondering what's wrong. This is basically your stomach or your digestion health. And when you think about the gut health, when you think about digestion, the simple biology, we say that digestion starts from the mouth, from your enzymes, from your bacteria that you actually ingest, and they actually influence the types of bacteria, as Grace has actually said. So whatever you take in, your digestion, your stomach acids, your stomach enzymes, your metabolism, all this actually, and the environment in your stomach, whether it's actually permeable or it is, no, it has leakages. We need to use simpler languages. It has leakages, of course. This actually influences how your stomach is going to digest, utilize, and metabolize, and even excrete the food that you have taken. So that is basically what we are talking about. And of course, Grace and myself, we did study, and we're also looking forward to go deeper into it, where we associated the dysbiosis or gut health or microbiome imbalances with the occurrences of metabolic syndromes like obesity. We were specific on obesity, but of course, as Grace has actually emphasized, gut dysbiosis or the imbalances in your gut is actually associated with the occurrences of certain conditions like diabetes and such. So maybe before we go further, we can just now, because I hope we've gotten. Grace, did you explain to us what dysbiosis is? Or you
No,
can?
no, no, we didn't get into that yet.
Yes, maybe you can just give us in the simplest language. Like now you're talking to that patient who does not know what gut health is. They've not come to terms with such things like inflammation and such. What dysbiosis actually means as we move forward, so that we are together.
Okay. Now, when we talk about your digestive system, we talk about you getting to eat, you breaking, your system, breaking down that food, and the different nutrients go to where they need to go, if they are going to storage or to repair somewhere that has been torn in an artery, or So going to your bones, an example of calcium, for example. So after that, you need to poop because there's an excess, right? And for you to poop, one of the biggest things is very healthy bacteria in your intestines, so that it will propel nicely, and then you get to poop nicely. You go for your long call and you have an amazing time. There's normally that amazing release that comes with going to long call, having your long call. But now imagine you get to eat day one. So today is Wednesday. You get to eat on Wednesday, full meals, breakfast, lunch, dinner. And if you crave sometimes, if you sit in an office, you get your 10 o'clock tea and kasamosa, or you go to a bandaski, unaenda kwa kibanda, unachukua mandazi. Where I am, we call them mandunya. Unachukua mandunya, unakula, all right? So the entire time since morning, so today is Wednesday, since morning you've been eating all the way to the evening. Then tomorrow comes, you get to eat again. All right? You get to eat again the whole day, but you've not passed your stool. All right? So when we say dysbiosis is imbalance. Things are not balanced completely. Your gut is not balanced. You're simply eating and eating, not getting rid of. All right. So what does that mean in the long run? It means that what is supposed to help you in your system, in this case, what is supposed to help you, one, propel that poop out and experience that amazing feeling of pooping, is either reduced or is not sufficient. All right. So, for example, for those who get to diarrhea, can't believe I'm using that word live, but diarrhea, you get to diarrhea, that, those bacteria, those things that you're looking for here, to ensure that you remain good, you get to diarrhea them out. Now, for some of us who get constipated, we barely have any. That is basically what it is. So when we define gut dysbiosis, think about that particular example I have given. Dysbiosis means there's an imbalance. Okay, and that means either you have one of those particular amazing gut bacteria missing, or they are kidogo, or they are not there entirely, and therefore you get to struggle a lot. Remember, like I said, our digestive system is the first place. If anything is wrong in our entire bodies, that is the one place that will tell us something is wrong. Either you have a stomach ache, you are feeling like you want to puke, yeah, or you even puke, or you diarrhea for the other bit of it. So when we define dysbiosis, we talk about now having that imbalance. Now, when we have a balance, it means that our bodies get to fight diseases very easily. Something as easy as common flu, you don't need meds for it. So inflammation simply means that your body is getting Kufura in English has left the group.
Inflamed.
Yes, inflamed. Now using the same word to explain the same word, but it's okay. Um, Literally. Inflammation may simply means that your body is constantly fighting. Yes, fight or flight mode. All right, that is when our bodies are in an emergency state. But imagine when your body is in this state continuously. Okay, very well. When it is in that state continuously, it is there because your immune system is not doing its job. Or if it is doing its job, then it's already overworking. And one of the ways of overworking our systems is eating the wrong food, the wrong time, the wrong the wrong food, the wrong portions of that food, of even healthy food, or even eating at the wrong time, and not having sufficient sleep, because that is something else that we talk about when we talk about balancing our gut health. So when your body is in a constant fight or flight mode, it doesn't know whether to run or to remain. All right. So what happens? Two things will happen. There's a hormone called the cortisol hormone. It remains constantly high. All right. And so long as it is high, your system will keep doing the fighting continuously. Okay. So it will do that continuously. That is number one. And then number two, what that does now, the hormone, now we're talking about cortisol hormone. So the cortisol hormone is up here. Your system is constantly in fight or flight mode. You're constantly tired, by the way. You'll note that you will feel constantly tired. You can't focus at work. In the long run, okay, in the long run, so we're talking about several years later, you notice that because of this, you have gained weight. And because of gaining that weight, your system is not sensitive to another hormone, which is crucial to this conversation called insulin. All right. So why? Because you've got a lot of fat storage blocking the sensitivity of insulin entirely. All right. So when you are not sensitive to your insulin, what happens? Your cells are not sensitive to your insulin, and this is your bloodstream. So these are the cells. Your cells here are not sensitive because there's a whole blockage around here. What happens? The glucose that you have eaten from your food, whatever you ate for breakfast, an example, ndoma, or you had a piece of cake, you had a slice of bread, that glucose, instead of going into the cell to do the function of providing energy, remains constantly in your blood system. All right. So when you come to us and then we get to check your sugar levels, we find they are very high. But remember, this is not something that has just happened once. It started somewhere, and it started with your gut having an imbalance, taking your body into a flight or fight mode. All right. And that means that your system produces the cortisol, technically two hormones, adrenaline and cortisol. So adrenaline is when you need to, run. Then there's a cortisol hormone, which remains up here consistently. That's the word. So it means that we can actually bring the cortisol levels lower, but this hormone remains high consistently. So your system is constantly inflamed, and that means you get to gain weight. You gain that weight, then because of that weight gain from the food you're still consuming, because you are not yet aware of this, from that food you're consuming, your body resists of listening to insulin, a hormone that is very crucial for you to have the sugar, the glucose that comes from breakdown of your carbohydrates, from ugali, the breads, the cakes, ndoma, yeah, your potatoes as well, from that glucose, yeah, because then product is glucose from that digestion. So that glucose doesn't go to do its job. It remains roaming around your system, in your blood system. All right. And that is actually how we're diagnosing diabetes, even type 2 diabetes, way, way, way early, unfortunately. So, like I said, we need to balance your gut for you not to be in a constant fight or flight mode. And if you need be, your good gut bacteria will do the job for you. And then you'll of course learn to relax at the end, because when you have sufficient sleep, then your system also goes to sleep, bringing down that inflamed state, your system not necessarily be inflamed. And that means you don't have to gain weight, and as well as having to gain weight, you don't have to be have what we call insulin resistance. Your system won't resist insulin entirely, and you'll take up your glucose without needing to stop, because you're getting good sleep. Lilian.
Thank you. Thank you. That was a very good explanation of gut dysbiosis. And if anyone has actually gone through the discussions that we had last time, Jerry, please keep quiet. Stop doing that. Just give me a minute. Sorry about that. Sorry about that. So, in the last conversation, we were talking about NCDs and what happens. And I think Grace has given a very good explanation of how gut dysbiosis or the imbalances in your gut actually contribute to disease. And from the conversations that we've had previously, of course, we have established that not just like, of course, we have so many other factors that come in and actually now intertwine in your metabolic system. They cause dysfunction and then they cause you disease. But from this discussion and from this conversation, we agree that it is core to actually understand your digestion health or your digestion system if we are actually to prevent the occurrences of NCDs. And the numbers in the country and globally are rising by the minute. That is a fact that we cannot dispute, and it's a sad fact. And of course, as Grace has said, NCDs do not happen because of one bad habit one week. That bad habit has to be recurrent. It has to be something that you're consistently doing that is actually affecting your health and your metabolic function negatively. So maybe as we get into deeper understanding of dysbiosis, we can actually now just talk about, because dysbiosis has been explained as the imbalances in your gut bacteria. So maybe before that, we can just give a small clarification of what the bacteria is. These are basically, as they are actually called, they are bacteria. They can be disease causing or they can be disease preventive. That's why we have the good and the bad. And we have to strike a balance because we need both. We need the bad to make sure that our immune system stays on toes, like it's active full time. And we also need the good to ensure that it does not outweigh to ensure that the bad does not outweigh the good and cause us diseases and diarrhea, vomiting, infections here and there. And there's a lot of studies that have actually been shown that dysbiosis has been associated with the occurrences of both communicable and non-communicable diseases. It is also a serious risk factor to metabolic disorders in children, in women, and in men. Like the general population, no one is actually protected if they're not actually taking care of their gut health or their digestion health. So maybe we can, because we talked about the previous videos, we talked about the causes of NCDs. Now in this, let's talk about what causes the imbalances. The imbalances in the bacteria. What will actually lead me to have gut dysbiosis as an individual? Grace?
All right. So, like I mentioned, we have to talk about replenishing the microorganisms themselves in our system, and then there's feeding those microorganisms so that there's sustenance of them in the system. Okay, and one of the biggest things we have to see is that for you to sustain something, it has either to be fed or to
Yeah.
be repaired,
Yeah.
right? So an assumption that we all have the gut microorganisms, so we have to feed them. So what causes the imbalance? One is when we are not feeding them. Okay, so what are we supposed to feed them with? That is what we call the prebiotics. Prebiotics are the food for the microorganisms. We're talking about amazing fiber, which is 25 to 35 grams. We're talking about amazing good fats. And in this case, we're talking about this particular one, short chain fatty acids, yeah, from the screen. They're actually right there. We're talking about those because, well, if we are talking about short chain fatty acid producing bacteria, they have to be fed by those particular fatty acids. That is what they recognize, that is what they appreciate. So if we are to talk about this, what are the sources? We're talking about either use of coconut oil, we're talking about eating avocados because, well, they're amazing as well. Your nuts and seeds providing good amount of good bacteria, I mean fiber, sorry, that will feed the good bacteria. So we have to feed the microorganisms that we are looking for. All right. Now, for those who are missing them, we have to replace them. Or, yeah, that's a word I would use. We have to replace them. So they've left the system either because you want treatment with antibiotics, for example. So after the treatment of your antibiotics, you have to replace them because antibiotics mean they kill, they antibacterial, and they don't select. If they are gram negative, cross. So you have to kill all of them for 5. You're taking antibiotics for say 5, 7, 10 days. So after that, you have to replace them. So majority of us either because especially after the COVID era, the COVID era came with an amazing, well, I wouldn't call it amazing now that I'm saying it out loud, but it came with an absolute use of antibiotics, even leading to antimicrobial resistance. Right now, that is a whole deal. Where I am, um, there's antimicrobial resistance to a drug called azithromycin, so that cannot be used entirely. So you don't want to be and get antimicrobial resistance. That means you have to replace after your treatment period, replace with probiotics. So probiotics are current existing gut microorganisms that you take in to replace those that have left your system. Okay, so you have to replace, you have to feed, and you have to replenish. Okay, so that is how the imbalance comes in. So the imbalance will come in if, one, we are not feeding. All right, so we are not replenishing, we are not replacing. Those two things are very vital. And this again becomes something that happens over time. It is not a one day's job entirely. It is something that happens over time. So you're either not consuming enough fiber and these amazing good sources of fats, or better still, you are also going for the ultra processed foods, which now kill and eliminate entirely. So ultra processed foods, what are we talking about? Anything that is not naturally, you're naturally occurring. You're talking about processed meats, your good bacon right there. You'll be talking about, sausages, smokies, team smoky pasua, tumefikiwa at this point. We're talking about the things that children like, teeny tiny things. Yeah, the other day there was a conversation about noodles. We are talking about that as well. We're talking about your cakes. Yeah, you have to think about it entirely. So that is a conversation, that those are things that are already available and affordable to us that we are using to kill our own guts entirely. I hope that makes sense. And then when we do not replace, that is something that is happening over time. So the first half of the year, many people get infections for weird reasons. Females, we ladies are prone to UTIs. We take antibiotic therapy. We do not replace that bacteria, the microorganisms you're looking for our digestive systems. And then gentlemen, kahoma kidogo, azithromycin, cetirizine, again, you do not replace that gut microorganism, and that happening over time brings that imbalance, which takes us to where the numbers are right now, Lilian.
Yes, Grace, I totally agree with you. Because when you think about balance, it's either you're replacing or you're replacing or you're not feeding.
Replenish.
So I think maybe to add on the dysbiosis thing, we also have habits that actually now trigger the dysbiosis. You see, when you talked about high stress level, when you talked about, stress, when you think about stress, most of us just assume about the mental and the psychological stress. Of course, it takes the biggest chunk of our levels of cortisols, but we also have other stressors like from intake of processed foods, like poor sleep, where you're not physically active, your body is not engaged, so it kind of gets stressed. So the high cortisol level has also been shown to have a negative impact when it comes to the maturation, development, and replication of the good bacteria, and this has a
Mm.
negative impact on the gut balance or gut microbiome balance. We also have habits like smoking. We also have habits like alcohol that have actually been shown to reduce the balance or to affect the balance negatively. And apart from that, of course, you talked about intake of highly processed and sugary foods, something that we have actually normalized, and we are still, like, if you have a conversation with a parent, most parents will be so shocked how much they are willing to step their foot forward to defend that their babies need to take Ribena, their babies need to take flavored milks, the baby needs to take those noodles, because how are they going to take mala? So I think that habits, the food dietary habits, that the cultures that we've actually normalized over time, is one of the main reason that we are actually having a lot of dysfunction when it comes to our
Mm.
gut metabolic health. We also have the aspect of food safety, where we are taking foods, and you guys are lucky where you are. You can actually produce your food, but you see us in the urban areas, unapata tu chakula, you have no other alternative than to buy from the market, and we have seen a lot of exposes on the same for the
Yeah.
longest time. And about safety, of course, when you introduce toxins in your body, what happens? They interfere with our gut functionality. And this has actually, now over time, it can lead to occurrences of disease. That, I think, that is it on gut dysbiosis. We've talked about sleep, we've talked about stress, diet, and all that. So maybe we can talk about now, you brought in the concept of blood sugar, that is basically insulin resistance and gut functionality very, very well. So how can we now, do we have, because you see you are in the renal aspect. I do not want to not talk about that. Of course, before we get to this functional nutrition, now, can you give us a small, like, the reality, what is happening there, where you having cases, the number of cases have actually skyrocketed when it comes to renal conditions, diabetes and hypertension, and can we actually say that they are directly linked to poor gut functionality due to poor dietary practices, stressors, toxin exposures, and the likes?
Absolutely, Lillian. And the the reality here is sad because I have 62 patients on dialysis currently. So the patients I've seen between Monday and today are 62, right? And we are currently doing the second session right now, and that will clock the 62 number. Now, please note more than half. I have 38 of them, their primary diagnosis, what we'll say was the cause of them having end stage um, renal disease was diabetes and hypertension. So that is more than half. The rest will possibly be coming from what we call urology issues. Issues to do with the genitourinary tract, from bladder to prostate, as well as the cervix, so reproductive, the cervix as well, or cancers. And cancers here, we're talking about the likes of multiple myeloma, prostate cancer, as well as cervical cancer. Now, those ones are the 62 minus 38, now remaining patients. Now, there's also among the remainder of those patients, I have teenagers who got what we call nephrotic syndrome, which is a specific kidney disease. That is a conversation we can always have later because there's a lot of data to that. But the reason why I said sad is because if if the knowledge we have now had been disseminated to them when they first got the diagnosis of, you have diabetes or you have hypertension, then I think there's a lot that would have been done then that now we're trying to do now. I am saying that because in the light of when we talk about gut health, we are able to help patients, be their diabetic, yes, but they no longer need to use drugs. They actually get to use nutrition and lifestyle change for the rest of their lives. We've got two particular patients where I am. One was diagnosed with diabetes in 1986, alive and well, no crazy complications besides just being hypertensive, and that came with age. And then the other one has been diabetic for the last 31 years. So that will be since 1994, 95, thereabout. And again, a male patient, and he's doing amazing. All right. So what they did, then they had exposure because they didn't really live, they worked outside the country, then came back to the country, got into civil service, and they continued with life. But one of the things that really helped them was changing their nutrition entirely, and that is what has helped them to get to where they are right now. The 1986 diagnosis is in his early 90s now, and he's doing really amazing. This other gentleman is approaching 80, should be 80 this year. And if we're being truly honest, it is daunting to think about where we are. Now, the primary things that the primary matter here is we're talking about obesity. So excess weight. Let me just put it as that, as excess weight. If we can arrest it at excess weight, and for those of us who are not having excess weight, if we can work on ensuring that our gut health is excellent, then we'll not be talking about having to take care of 62 patients with dialysis. Amazing humans who would be more productive out there if they weren't coming to get their blood cleaned out twice a week or thrice a week, because I have those on thrice a week. Yeah. So everything trickles down to way before the life choices we are making right now. The decision to take that office samosa or not. Yeah. That decision of not using the stairs and having to to use the lift instead. The decision of I'll stay up until midnight and I have to wake up at 4 a.m., beat the jam, get to work by 8. So if we made the decision of sleeping as we should, if we made the decision of going for therapy when stress levels are just crazy, or putting the phone down and making human, the word is human connection. And that is how we get to talk. We get to talk about how was your day. Literally, Lilian, if I asked you right now, hi Lilian, how are you? The answer I'll get is, girl, I'm fine. And we simply
Yeah,
move on. Yeah. That
yeah,
is what we are used to. And sadly, we get to copy paste what we get to talk on, on chat on WhatsApp. Hi, how are you? I'm fine. So I need this and this. No, moving on swiftly. If we were intentional with our social lives, and in this case I mean, when you are stressed, not going to take that thought of tequila, throw it down, kill your bacteria over and over again, and make your system to be in a fight or flight mode consistently. If we are intentional, I am saying we are now, because hey Lillian, we're also human, we are not out of that list. Literally, if we are intentional, then there's a lot of things that we'll be doing correctly right now. Therapy is for everyone. It is
yeah.
for everyone. No one can escape it. Therapy sounds like going somewhere and kupiga nduru moja safi, right?
Which is
Therapy
necessary, by
sounds,
the way.
yeah. Therapy
Mm,
sounds like take taking your phone on airplane mode at night, so long as you're not, Lillian and myself, or myself at this point, who can get called as late as 11 p.m. by a patient. All right. Taking it on airplane mode and, saying what, I need me time. I need
yeah,
to catch up with myself. How am I doing? How am I doing physically? How am I doing mentally? All right. Therapy sounds like taking a Saturday morning walk or a very Saturday evening walk. Um, Therapy sounds like taking your child to go and swing somewhere and you getting on that swing yourself and swinging as well. Things that
Wow.
get to us to reduce the cortisol levels completely. Will they shoot up again? Yes. But would you have figured out healthier ways to bring them down? Absolutely. That is where we are right now. But we have to be intentional. If we are intentional to go to Bandaski, get that Mama Mboga's number, and tell them, hey, I need greens za 20 bob. That will be enough for you. So by the time you're leaving work getting to Mandaski, chape story kiasi, siku ilikuwa aje, umeuzauza, get your 20 bob, go make amazing dinner, no distractions. Do something with your hands. That helps with relaxing your nervous system. And that in the long run means that, remember the hormone we mentioned, cortisol level, simply comes down. The adrenaline simply comes down. All right. So we have to think about it from that. Otherwise, the current numbers of having 56% of Kenyan women are overweight and obese, according to KDSG 2024, that is barely a year ago. Those numbers are going to keep shooting. And instead of having a healthier and productive generation, we'll be having an unhealthy, productive generation, increasing the disease burden of this country. And that means we strain our own economy. And it's just not that we're not just looking at the GDP, we're also looking at our own household economy. Because it means when you budget for the month, you have to budget for medicine. All right. And that is for yourself, for the next person, and the next person entirely. Lillian.
Kabisa, kabisa. And I like the fact that you've really emphasized on the stress management aspect, because most of us, when we are tackling disease, most of us, when we are talking about the importance of preventing disease, we talk about stress management as a by the way, which should never be the case because it's integral. There's a lot of data that show that stress currently is a direct causative of metabolic syndromes, including diabetes, hypertension, and many other conditions. So, of course, we have to work towards making sure that we reduce the levels to maintain normal inflammation levels. I know it's almost impossible to find someone with the perfect biomarkers when it comes to hormonal balance, inflammation rates, but we can try. It never has to try. And I think the examples that Grace has actually shared, taking walks, talking with your neighbors. Most of us do not even like that. Like we hide or we mask behind we are private. So we don't want to talk to people. We don't want to engage with people. We don't want to say hi to people, which is very sad. And the human interaction is slowly dwindling. And the social media is actually now encouraging use of screens. As you've said, if you call me and ask me, Mumina, how are you doing? I'll just tell you I'm fine, regardless of what I'm going through. It's not easy for someone to just decide. But if I am with you one on one, it's very easy for me to decide otherwise. And maybe I can let you in on whatever I am going through. So as we talk about
Yeah.
functional nutrition, because that is what we are going to talk about. And it was a trend in last year. Let's also make it a habit to manage stress or to do something that actually relaxes your nerves every single day. Because, of course, you're not supposed to bring the cortisol levels at all times, but taking a break from the high levels of cortisol is a good thing. Taking a break from the fight and flight mode, your body is a good thing. Taking a break from the chronic inflammation is a great thing. One of the best ways that you can do that, some of the things that you can do, breathing exercises. Ukisikia imezidi, you pause, you breathe, you pause, you go for a walk, you pause, you go and anza udaku na jirani. Hata si jirani, toka tembea. Kama unaogopa kuongea na majirani, Go look for some stranger and start a conversation. When you're in a matatu, talk to your neighbor. You know, hii maneno ya kila mtu ako kwa simu kwa matatu, it's becoming a serious problem.
Unbecoming.
Yeah. So, yeah. Now, as we move forward, we talk about functional nutrition. This is basically using food and power foods and lifestyle targeted nutrient to support body systems. It has been a popular trend since 2024, where we are having a lot of people in business in the nutrition space actually selling functional food. We have seen moringa. We have seen, I sell myself wheatgrass. We have seen other foods, kombucha, you talked about it. We have seen kefir, because they have additional nutrients or they have additional support to the metabolic health. And this actually now makes them functional foods. So let's talk about briefly, can you explain to us, before we get to the gut strategies to restore balance and to reduce disease risk, what these functional foods are, or what functional nutrition embodies in a very
All right.
language?
All right. Now, as far as functional nutrition sounds like a huge word, but in actual sense, it is picking out what is readily available to you. That is normally my approach. You pick out what is readily available to you, available, affordable to you, that gets to deal with the root cause of your problem. Okay, so you get to deal with the root cause of your problem. Now, for example, there's another one that is trendy as well, Lilian. The use of hibiscus tea to manage hypertension, and it works. All right, but it will not work alone. Now that is where I'm headed.
Yeah.
When we use the food that is readily available to you, we get to add these other things that get to solve your problem, yes, from the root cause, by not neglecting all these other foods. All right. Now we are getting to the gut fast strategies in a minute. We have to think about you as a whole person, not as the problem only. Because you have to live life, you have to climb the stairs, you have to breathe, you have, all these other things your body gets to do. All right. So if stress is your problem, stress alone is not the problem. Stress gets to affect the entire system. So we have to pick out food that you can sustain. Okay, so affordable, achievable, and you will easily sustain, in conjunction with what we call functional foods. What we just mentioned is moringa, for example. It's an addition, all right, to deal with your root cause, but at the same time to ensure that your normal self will function as normal self, normal healthy self. All right, so you get to solve the problem that you have, but at the same time get you to attain a very good healthy self. And when you talk about healthy self, we're talking about emotional, we're talking about mental, we're talking about physical health as well. So functional foods, my approach is that you will get to solve the root cause of your current problem. So you get to heal using that food, but at the same time, ensure that all these other bits and parts of you are also healthy in its entirety. All right. So we get to use we get to use food and lifestyle to support your body system to heal, but at the same time ensure that that lifestyle will consistently remain. All right, so those foods remain for you, provide you with all the nutrients you need, all the vitamins that you need to live out and lead a healthy life. Lilian.
Yeah, that's true. That's true. And I like the fact that you say that we actually make it look like a big deal. Ukiona mtu akiuza hizo functional foods wakisema the way, and some people actually sell it as a solution to everything without any other adjustment. Mtu anakwambia you can even go ahead and eat whatever you like, provided you're taking it, provided you're taking 1 scoop of molasses, 1 scoop of what else? fenugreek, 1 scoop of this, chlorophyll, hibiscus.
Mm,
You can just go ahead and continue with your junk, with your highly processed foods, highly contaminated foods, and nothing will happen because you're taking a functional food. I think that needs to be
mhm.
thrown in the trash because it does not work that way. As Grace has said, these are basically foods that actually support your habits. So if your habits are bad and you're taking 1,000,002 functional foods, itakuwa shida because you might also overload your system with toxicity because some of them require heightened mechanisms to detoxify and to remove the waste and such, or even the metabolites after the usage of the body, after the body takes up what it can, when it's trying to reduce or to get rid of what it doesn't need, they might require maybe extra fluids, they might require extra water, they might require extra function from your liver and your kidneys. So, of course, as we take this functional nutrition, it's not a bad thing, it's a good thing, but we have to be very um, realistic about it. We also have to be comprehensive and also think on adapting to changes when it comes to dietary and lifestyle practices. So, as we talk about this slide, we're going to move to the next slides as we talk about the gut strategies or how functional nutrition interventions can actually help with the gut. And I think this slide has actually now highlighted what we have talked about. So, Grace, I think we'll skip to the next one because it talks about how the gut hosts over 70% of our immune systems. It regulates
Yeah.
metabolism, inflammation, insulin sensitivity, and poor gut health leads to dysbiosis, which causes inflammation, insulin resistance, and chronic diseases. We all know that. So let's talk about some of the strategies. They are just there, Grace, but you can explain it to us. What are some of the strategies that how we can apply functional nutrition or a targeted nutrition to actually now reduce the gut imbalances, gut dysbiosis, improve outcomes when it comes to managing and preventing the occurrences of NCDs, because we talked about the previous videos. And remember, if you're struggling with diabetes, if you're struggling with hypertension, chronic kidney diseases, obesity, and any metabolic disorders, you can reach out. Grace, you'll need to type your number. The other time I typed, it didn't come out on the comment section. So someone,
I can do that.
yeah, consultation. Mama, I don't know how to type. But I don't know why it didn't show. Chat publicly as
I
Mumina.
posted it.
Okay, good. So you can definitely reach out for personalized and individualized consultations. As we always say, everything we have blanket recommendation, yes, but we need to be specific. If you remember what Grace was talking about, she said that certain factors, we are all exposed to microbes. When you come out from your mom's womb, of course, you get exposure to microbes, regardless of how you came in, whether ulikuja na vagina or C-section. The food, the environment is full of toxins, and we are exposed to different toxins and different microbes because of our dietary patterns in our homes, our cleanliness habits, how our moms actually take care of us. But again, in the long as we continue living, of course, things change, and maybe we've been exposed to a lot of sugars. Maybe I have not. Maybe Grace, you have. So of course, our microbes will be different. Hii kitu ni
Different.
kama thumbnail ama ni kama hiyo kitu ya kuchukua fingerprints. Ni kama fingerprints. No one has the same as the other. So we are all exposed to different microbes and our systems are different and we react different to certain adaptation and even changes. That is why individualized care is actually recommended. So Grace will leave her number. If you need that, you do that. So let's talk about some of the strategies that we can actually apply as a population who's actually struggling with gut issues. And Grace?
All right. So strategy number one, diversify what you get to put in your plate. Okay. One thing I love about our country, Kenya, is the diversity in our cultures. You will find amazing, amazing foods. are really, really amazing foods. Recently, I had the pleasure of interacting with the Burji, originally from Ethiopia, but there's a whole, uh, a whole culture and good amount of that community in Kenya. And it is amazing how they ferment their injera. The injera was a bit different from what I've tasted before from Somali culture, and it was so good. You cannot even consume more than half of it, yet it is already fermented. Yeah. um if you go to Eldoret, you'll take mursik from the Kalenjin culture. If you come to us, we try we are trying, but then there's a lot of veggies. Like, we've got these amazing vegetable options, from bean leaves to cowpeas, pigeon peas leaves, cassava leaves. All right. I don't know the one that I had last week. I can't remember what it is called, but I know it in mother tongue. It's called nderema. That is a much I know about it. Yeah. We
That's
got
from
sweet
Kisii, eh?
potatoes. We got, sorry.
Nderema. Nderema is from Kisii. It's a
Oh,
delicacy
for
from
real?
Kisii.
Yeah, I haven't.
Yeah, Kisii
Oh,
and the Koreans.
interesting. I didn't know.
It has very
That
nice.
is
It has
amazing.
an acquired taste. You have to eat like twice or thrice, ndo ifurahishe.
I ate it the first time and I loved it. So
Nice.
that is one of the veggies that for me is a go-to currently. There's saget, misebebe. We got varieties, right? And we've got those varieties such that year in, year out, you'll find something to eat fresh.
Yeah.
You'll find something to eat. But now on the urban end for you, Lilian, then it would mean skuma spinach songa, skuma spinach inama ipite, skuma spinach, like that can be the trend very easily, yeah.
Squeezy,
But here's the
they
thing,
they
yeah.
even wanatukatia skuma na spinach. So you don't even know whether it's skuma and spinach. Unaenda tu unanunua kama imekatwa. Zimekuwa hapo skuma spinach 20 bob.
Oh,
We are suffering.
yeah,
Hmm.
that too. All right. And then what is readily available to, especially the urban centers, are the food deserts. Yeah. So they simply sell ultra processed food completely. And the monotony is, if you cannot go and purchase, you'll simply order in, it gets to your door. That's number one. Number two, there's, chips muitu as well. Affordable, 30 bob, kachumbari kiasi, and you go, you sleep. That's basically it. We have to be intentional. It's not that these things are not readily available to us. We have to be intentional and then delve into the diversity that is our culture. Delve into it. Pick out. You'll If you talk to people who come from the Kisii culture, they tell you our grandfathers and grandmothers used to take this and this and this and this. Do your research, delve into it, right? If you go to Burj is an amazing culture. Trust me, that is one place I would go again. If you go to the Kalenjin culture, they'll tell you our forefathers used to do this and this, or rather, don't dash into the forefatherhood. Just go to your grandmother or your grandfathers. They will tell you this is what we used to take, and it used to ensure that we are doing okay. Functional foods as well, looking like the foods that we get to eat right now. Our country is diverse and is beautiful, and so are the beautiful people and the cultures in it. Delve into them, pick out what is amazing. The healthy fats that were used at the time were the likes of lard and tallow, right? If you have access to that, amazing, utilize it. All right. So that is strategy number one. Strategy number two, utilization of prebiotics and post probiotics. Like I explained before, probiotics are fermented foods that contain the microorganisms that we need to replenish so that Our immune cells are constantly supplied. They don't deteriorate, and we ensure that we are good. So prebiotics are the food of these microorganisms. All right. So if you are, say, you already taken your antibiotics, you're done, and you've taken a probiotic such as kombucha or kefir yogurt. Now you want to ensure that those microorganisms in your digestive system stay there and they're healthy. You have to feed them. So what are you feeding them with? You're feeding them with a good amount of fiber. And the fiber will come from your legumes. We're talking about your greens, which we've literally described from the first corner to the last corner. So you have to focus on ensuring that you feed your system. And that means you're looking at your fiber as your biggest focus. Legumes, in this case, we've got so many. The roko, or cowpeas, pigeon peas, njahi, dengu. We're talking about mbaazi. We're talking about your beans, from yellow beans as well to wairimo, the different amazing varieties we got. If you go to the indigenous seeds bank, you will find amazing varieties of these legumes. Get them, consume them as well. They'll give you an amazing amount of fiber too. And then the other strategy that you can ensure that you're utilizing is limiting purchase. So don't go buying intentionally. You have to set up your mind that I am not doing this. I'm not comfort eating using cake. I'm not comfort eating using fries and chicken, deep fried chicken, by the way. I'm not comfort eating. I'm not stress drinking using soda instead of using water for your hydration. So we're looking at limiting those foods that will disrupt your microorganisms that you are maintaining. So we're talking about excess sugar. We're talking about alcohol intake. We're talking about processed fats from deep fried food. And when you're taking antibiotics unnecessarily, all right, please get a prescription for you to take antibiotics. Don't self-prescribe yourself antibiotics. Okay, so that is something that you have to think about. The reason why all these things are necessary is so that you are healthy consistently. Okay, hydrate yourself with good hydrants. We know we have all these other hydrants in the system, yeah, and in the market, but be intentional to select good hydrants. We're talking about kombucha. We're talking about your simple water. If you want to add something to it to be a bit tasty, that's fine. You can add your lemon, apple cider vinegar. You can add chia seeds, something that will just help you to keep hydrating yourself. Move. Now, we've got a good number of us who work in the office, or basically our work is sitting down. Please move. Instead of using the lift, switch to stairs. Okay. Move around. Every 2 hours, get up, just move around. Come back, continue your work. The moving around already gives you a mental break, which is amazing. And like I said earlier, stress management is key. We cannot not mention that. Yeah. Find healthy ways of dealing with yourself. Interact with physical humans. The humans on phone are also humans, but interact with physical humans as well. That should help you, and that should help us in the long run. Lilian.
Kabisa, I totally agree with you. And I think those strategies are usually so easy to talk to or to talk about, but implementation inakuanga shida. So maybe in our next conversation,
True.
we can talk about how to wire behavior change, long-term behavior change. Sio ya siku
Yeah.
mbili, because we've seen over time there's a lot of hype about a program. Like I have very few taking women on a certain program, and the excitement is usually very, very much the first 2 days. Like what you alafu after a few days, people stop Like they tell you, oh my God, I'm struggling. People start giving excuses as to why they should not do that. Maybe we can approach a different angle and see how we can talk about it. Now, you have talked about some of the strategies that we can
Sure.
actually improvise in our public health institutions, or even as people, as someone who's listening, who's currently struggling with certain conditions. And you are in the clinical care setting, that is basically you do what? As you said, you told us that we talk around, and maybe we can just slightly a conversation of some of the gaps that we have in the country before we finish up, some of the gaps that we have in the country when it comes to utilizing and actually taking up these cost effective strategies to not only prevent but manage and treat the NCDs that we have in our populations, because we have a lot of them. We have diabetes, we have cancers, we have kidney conditions, we have hypertension, and all this can actually benefit from effective nutrition intervention that are staged early and sustained all through their treatment procedures. Grace?
All right. So I think I'll tackle both opportunities as well as, the missing, the
Yes,
missings.
please
Yeah.
do. Please do. Yeah.
So as far as missings, the gaps. So one, we've got the gap of our own colleagues not being on board. All right. And that means capacity building has to happen. So that's an opportunity on its own. Capacity building has to happen, and we have to embrace this. There's enough research; it is evidence based. We have to embrace it. So that is one. Second gap is that we've not been able to take this research, internalize it, and then develop guidelines into them. All right. If we go into policy development and guidelines, that's a whole conversation, and that is something that's missing. Is it something that is doable thanks to our different levels of government? Yes. Is that something that is doable thanks to our different associations, professionals associations? Yes, because that is how we disseminate information that is standardized all across. All right. But instead, there's the promotion of all these other options before lifestyle change. We're talking about surgeries. We're talking about pharmacological options first before lifestyle options first. And probably that is one of the reasons why, yes, we have a good number of excessive weight clientele and population taking the pharmacological route because it looks like a shortcut, right? But then something interesting is that shortcuts, they will create problems that you didn't prepare for nor prayed for. All right. There's a reason why we've got food and amazing options for us. But when we do not get to deal with self, then that's it. And that is where the market has been tapped into because everyone is looking for the fastest way to lose weight, right? Yet we are not changing what is on the plate. Right. So there's that re-emphasizing, placing other options before lifestyle options, which I think is sad. Again, the need for capacity building for our own colleagues to take up lifestyle options first before the alternatives are brought into the picture. As far as all these other things are concerned, for example, last week we had the conversation of taxing
Grace?
and we go to foods that are hello, hello.
Yes, I can hear you. I think I had dropped you, ama ni mic yangu, but, but
Yeah.
but now I can hear you.
All right. So the last thing that I think would help is like literally placing a tax, an extra tax on ultra processed foods entirely, just not to make them really affordable. And the alternative will be healthier, locally available foods. As far as the information getting to people is concerned, I've seen organizations that are doing that. There's one that is normally running in our televisions from in media stations of greens being part of every meal. I have seen that consistently, and it's been consistent, I think, for the last 2 years. So that too, if our different levels of government will take that up as well, that would be amazing. Provision of safe food from soil health. You remember seeing the expose last week of what did they call it? The
The
toxin trade
toxins
as
in
well.
pesticides, yeah.
Yeah, yeah, leading from pesticides to insecticides and herbicides as well. It is a whole responsibility that crops, yes, from the government, but directly down to the farmer as well. And from the report, you'll be told that the farmers will get to do, they separate what they will consume at their home and what is going to the market are the two different things. So if we would love each other enough to provide proper food, please farmers, that would be amazing. The banning of these chemicals across East African community would also be amazing because of the black market in and out of our country as well. So that is just not from a policy perspective, but also that trickles down to implementation. That way we get good soil health, good produce, and that means good nutrients at the plate level. Lilian.
Wow, thank you so much, Grace, for that. And I think if we are to move forward with your recommendations, things will be much, 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 much easier for Kenya and Kenyans in general. But again, our problems are many. So this was a case study. I think
Oh,
we're now
please
going to
add
talk
political will to that.
yeah, political will. And I think as nutritionists and as public health people with interest in public health, we really have to start
Yeah.
thinking about getting into the political space, because over time we have seen that yes, you can want to create a positive impact, you can want to create positive influence, but there are some influence and impacts that you can only do if you are in the political space or the political goodwill is
Mm-hmm.
actually available. So over time, of course,
True.
it has improved. We are having politicians having interest in now addressing what Kenyans are facing. They even talk about health. They talk about nutrition, which is a good thing, but there's definitely more that needs to be done if we are to move
Absolutely.
forward pamoja. So I think these are the system gaps that you are talking about. We will not get into them,
Yeah.
and these leadership priorities. So maybe as we wrap up, because we are almost at our closing time. Actually, we are. It's 5 minutes past. Maybe we can just continue this conversation. There's more to gut health. Maybe next we can talk about now equate to like the topic of discussion is on the strategies to improve gut functionality in people struggling with gut issues. I'm a GAD, the stomach issues, because I can tell you one of the most commonly asked questions in my inbox ni Mumina, niko na acidity Mumina, nina bloat Mumina, I've done everything and nothing seems to work. You talk about certain, that's why I talked about behavior change, because you have talked to these people and they're still not doing that. And maybe I've just thought about it, Grace.
Mm-hmm.
We are women. And it's cervical cancer awareness month. Can we talk about some of the strategies to improve? I don't want to say, okay, there's no other way of saying it. Strategies to improve vaginal health as a preventive mechanism for certain reproductive cancers and UTIs. That can work, eh?
Absolutely.
That can work. because now you now optimize the gut health and how the human or the women, female reproductive health system actually works, how they take up nutrients, why elimination of toxins, and of course the exposures that comes from a compromised immunity because of the infections of the
Yeah,
HPV. So maybe as we close,
absolutely.
since we have written them down there, we'll just read. It's about time that we evaluate what we are eating. Think about your nutrition or your plate as that support is either going to support you to fight disease or to actually now feed into disease. You know, that is a very common term. You say that when you're eating, you're either feeding or preventing disease. It's a very popular term. Most of us are aware of it, but most of us do not understand what it actually means and what it actually needs to be implemented. So anytime that you're taking your
Mhm.
food, remember to make it as whole as it can, to make it as safe as it can, to make it as natural as it can, and if possible, make sure that you also do fermented foods. We have the fermented uji from Meru, by the way. Where I live, there's a mama who sells it, and I have a cup every now and then. The problem is she adds too much sugar. But if she
Sugar.
doesn't add the sugar, people will not buy it. So I think we also need to have awareness about the importance of moderating intake of certain things that actually erode the benefits of taking those fermented foods. Because you see, with that uji, I'm telling you, hata kama iko fermented and it's so good, the sugar content, it can make things so bad. And if you suffer from bloating, fatigue, cravings, and constipation often, it's also a good time for you to recheck on how your digestive or your gut health actually works. And again, if you are a frequent user of antibiotics or if you're on long term medication, let's say things like ARVs, you are on anti inflammatories, you are on antihistamines, or you are in even diabetic medication or blood pressure or even cancer treatment, just any long term medication that requires you to take drugs for more than 5 days, of course, your gut health might have been affected. It's also a good time for you to now sit down and start thinking about the strategies that we have talked about that actually help us in restoring and improving our gut functionality, including gut balance. So, asante sana, Grace. Maybe you can give us a parting shot as we close.
All right, my parting shot is simple. Prioritize your gut health. Discipline is consistency, it is not perfection. Take a day at a time. You will be okay.
That's true. And remember to drink water, by the way. Hydrate, hydrate. If you have noticed, I've taken 2 of this. This is my second one.
If you don't drink water, you'll be dry.
Sorry about the background. Some people, they need to be punished, but it is well. So thank you, Grace, for this. No, please, I told you to not disturb me. Sorry about that. It is well. We are told to actually enable inaitangwaje autonomy, si autonomy, independence in thoughts and action. But gentle parenting is not easy. It's not easy at all. So thank you guys for tuning in. I hope you have gotten something. And we really appreciate if you have any questions regarding the gut or the topic that we have talked about, NCDs, gut functionality, weight management, diabetes, hypertension, or anything, make sure that you leave them in the comment section. Grace and I will be on the lookout and we'll definitely have a conversation on that. So asante sana, Grace, for tuning in. I think we can end it there. We are good?
Sure, yeah, sure, no problem.
Okay. Next, we talk about how to take care of our vaginas as a preventive strategies to this a lot of conditions that our women are struggling with. So we'll see you guys on